4 warning signs. You should never take magnesium for your heart. 5 signs you must take it daily. Are you tired of living with chest pains, irregular heartbeats, and constant worry about your cardiovascular health? Imagine waking up each morning feeling energized, with a heart that beats strong and steady, free from the nagging fear of heart disease that's been keeping you up at night. That pain in your chest when you climb stairs, the shortness of breath during simple activities, the concerning pressure that comes and goes, these aren't just inconveniences, they're your body desperately trying to tell you something is wrong. I understand the frustration of trying medication after medication, each with their own list of side effects, sometimes worse than the original problem. Today I'm going to reveal something that pharmaceutical companies don't want you to know, the truth about magnesium and your heart health. This powerful mineral could be the missing key to transforming your cardiovascular system, but there are critical warning signs you must know about first. Some people should never take magnesium supplements, while others are suffering needlessly by not taking it daily. By the end of this video, you'll know exactly which category you fall into, and how to take immediate action to protect your heart. If you've been struggling with heart concerns, please take a moment to like this video and subscribe to our channel for more life-saving information. And don't forget to check out the first link below to learn about a product that can help improve these health issues twice as fast. Your heart can't wait another day for this information that could literally save your life. Let me start by explaining why magnesium is so crucial for your heart. This essential mineral is involved in over 300 biochemical reactions in your body, but its relationship with your cardiovascular system is perhaps the most significant. Magnesium helps regulate your heartbeat, supports healthy blood pressure, prevents blood clots, reduces inflammation in blood vessels, and even impacts cholesterol levels. Despite its importance, studies show that approximately 68% of Americans don't meet the recommended daily intake of magnesium. This deficiency is silently contributing to the heart disease epidemic we're facing today. What makes magnesium so powerful for heart health? First, it acts as a natural calcium channel blocker. This means it helps your heart muscle cells relax properly between beats, preventing the dangerous calcium overload that can lead to arrhythmias and heart attacks. Second, magnesium activates the enzyme responsible for creating ATP, your body's primary energy currency. Your heart is the most metabolically active organ in your body, requiring enormous amounts of energy to beat over 100,000 times each day without rest. Without sufficient magnesium, your heart literally cannot produce enough energy to function optimally. Third, magnesium helps dilate your blood vessels by enhancing nitric oxide production, reducing blood pressure and improving circulation throughout your body. The science is clear. Your heart simply cannot function properly without adequate magnesium. Before I continue with this potentially life-changing information, I want to pause and make a more personal connection with you. Has anyone truly listened to your concerns about your heart health? I know how isolating it can feel when doctors rush you through appointments, or loved ones minimize your symptoms because they can't see them. If you're feeling heard by this information today, I'd appreciate if you'd leave a comment saying my heart matters or share a specific symptom you've been experiencing. Your comment does two important things. It helps others know they're not alone in their struggles, and it helps our algorithm reach more people who desperately need this information. Many in our community have found that simply expressing their concerns has been the first step in their healing journey. Now let's continue with the critical warning signs that indicate you should not take magnesium supplements. Warning sign number 1. You have kidney disease, particularly advanced kidney failure. Your kidneys are responsible for regulating magnesium levels in your body by filtering excess amounts into your urine. When kidneys aren't functioning properly, magnesium can build up to dangerous levels in your bloodstream. This condition, called hypermagnesiemia, can cause serious heart problems including low blood pressure, irregular heartbeat, and in severe cases, cardiac arrest. If you have kidney disease with a glomerular filtration rate below 30 ml/minute, magnesium supplements could be potentially life-threatening. Even those with moderate kidney disease should only take magnesium under close medical supervision with regular blood tests to monitor levels. The symptoms of magnesium toxicity can be subtle at first, just feeling unusually tired or weak, before progressing to more serious neurological and cardiac symptoms. If you have any level of kidney disease, please consult with your nephrologist before considering magnesium supplementation, regardless of how beneficial it might otherwise be for your heart. Warning sign number 2. You take certain medications that interact dangerously with magnesium. Several common medications can have their effectiveness reduced or their side effects amplified when combined with magnesium supplements. For example, many antibiotics including tetracyclines, quinolones like Cipro, and nitrofurantoin can form complexes with magnesium that prevent the antibiotic from being absorbed. This means your infection might not be treated effectively, which could be life-threatening depending on the type of infection. Similarly, bisphosphonates used for osteoporosis, like Fosamax, can be rendered almost useless when taken within several hours of magnesium. Perhaps most concerning for heart patients are the interactions with cardiac medications. Digoxin, a medication prescribed for heart failure and atrial fibrillation, works by affecting the movement of sodium and potassium in heart cells. Magnesium can alter how digoxin affects the heart, potentially leading to dangerous changes in heart rhythm. Blood pressure medications can also be affected. Magnesium may enhance their effects, causing blood pressure to drop too low and resulting in dizziness, fainting, or falls, which are particularly dangerous for older adults. Always review your complete medication list with your doctor and pharmacist before starting any magnesium supplementation. Warning sign number 3. You have a specific heart rhythm disorder called bradycardia, which means your heart beats too slowly, typically fewer than 60 beats per minute. While magnesium is often beneficial for people with rapid or irregular heartbeats, it can be dangerous for those with already slow heart rates. Magnesium has natural calcium channel blocking properties, similar to medications like verapamil or diltiazem. These effects can further slow conduction through the heart's electrical system, potentially causing your heart rate to drop to dangerously low levels. Symptoms of bradycardia that's been worsened by magnesium might include extreme fatigue, dizziness, confusion, fainting, or even seizures in severe cases. If you have a pacemaker for bradycardia, you still need to be cautious with magnesium supplementation. While the pacemaker provides a safety net to prevent your heart from beating too slowly, high levels of magnesium can interfere with the pacemaker's function or make your heart less responsive to its signals. Anyone with bradycardia should have their heart rate and rhythm monitored closely if they decide to take magnesium supplements. Warning sign number 4. You have a specific type of genetic condition called myasthenia gravis. This autoimmune disorder causes muscle weakness and fatigue because antibodies block or destroy receptors at the junction between nerves and muscles. Magnesium can worsen this condition because it reduces the amount of acetylcholine released at these junctions, which is the chemical messenger needed for muscles to contract properly. For someone with myasthenia gravis, taking supplemental magnesium can increase muscle weakness, including in critical muscles used for breathing and swallowing. This could potentially trigger a myasthenic crisis, which is a medical emergency requiring immediate hospitalization. The heart, being a muscle itself, can also be affected. If you have myasthenia gravis and are experiencing heart symptoms, it's essential to work with both a neurologist and cardiologist to develop a treatment plan that doesn't involve magnesium supplements. There are other nutrients and approaches that can support heart health without worsening your neurological condition. Now that we've covered the 4 warning signs indicating when you should avoid magnesium supplements, let's discuss the 5 clear signs that you might benefit tremendously from daily magnesium supplementation for your heart health. If you found this information valuable so far, please take a second to like this video and subscribe to our channel. Remember, the first link in the description leads to a product that can address these health issues twice as effectively. Sign number 1 that you need magnesium. You frequently experience heart palpitations or arrhythmias. That fluttering sensation in your chest, the feeling that your heart is skipping beats or racing unexpectedly. These can be frightening experiences that send many people to emergency rooms across the country each year. What most cardiologists know, but don't always communicate effectively to patients, is that many cases of heart palpitations are directly linked to magnesium deficiency. Your heart's electrical conduction system relies heavily on the proper balance of electrolytes, with magnesium playing a crucial role alongside potassium and calcium. When magnesium levels are low, the electrical impulses that control your heartbeat can become erratic. A 2019 study published in the Journal of the American Heart Association found that patients with frequent premature ventricular contractions, a common type of arrhythmia, saw a 75% reduction in symptoms after just 6 weeks of magnesium supplementation. The most remarkable aspect was that these patients had normal serum magnesium levels on standard blood tests, highlighting the limitation of conventional testing. If you've been told your arrhythmia is benign, or that you just need to live with it, magnesium might be the solution you haven't been offered. The form matters significantly. Magnesium taurate and magnesium glycinate have shown the greatest benefits specifically for heart rhythm issues, as they're well absorbed and have additional cardioprotective effects. Many patients report feeling improvement within days of beginning proper supplementation, with the full benefits developing over several weeks as cellular magnesium stores are replenished. Sign number 2 that you need magnesium. You have high blood pressure that remains difficult to control despite medication. Hypertension affects nearly half of American adults and is a leading risk factor for heart attack, stroke, and heart failure. What many people don't realize is that magnesium deficiency may be a significant contributing factor to resistant hypertension, high blood pressure that doesn't respond adequately to multiple medications. Magnesium works to lower blood pressure through several mechanisms. It relaxes the smooth muscle cells in your blood vessel walls, allowing them to dilate and reduce resistance to blood flow. This is known as vasodilation, and it's one of the primary ways that blood pressure medications work. Magnesium also regulates other minerals crucial for blood pressure control, including calcium, sodium, and potassium. A meta-analysis of 34 clinical trials published in Hypertension found that magnesium supplementation produced a small but clinically significant reduction in blood pressure. On average, participants saw a 2 mmHg reduction in systolic and diastolic pressures, with some individuals experiencing much more dramatic improvements. While this might not sound impressive, even a 2 mmHg reduction in blood pressure translates to a 10% decrease in stroke risk. For those with severe deficiency, the benefits were even more pronounced, with some patients able to reduce their dependence on blood pressure medications under medical supervision. If you're taking multiple hypertension medications and still struggling to reach your target blood pressure, magnesium supplementation might be the missing piece, addressing a root cause rather than just managing symptoms. Sign number 3 that you need magnesium. You have coronary artery disease or have had a heart attack. If you've been diagnosed with coronary artery disease or have survived a heart attack, magnesium should be a cornerstone of your recovery and prevention strategy. The evidence for magnesium's role in protecting against further cardiac events is compelling. When a heart attack occurs, magnesium levels in the heart muscle drop significantly. This decrease exacerbates the damage caused by oxygen deprivation and increases the risk of dangerous arrhythmias that can prove fatal. Hospitals have used intravenous magnesium for decades in certain types of heart attacks because of its protective effects. Beyond the acute setting, daily magnesium supplementation helps prevent the progression of coronary artery disease through multiple mechanisms. It improves endothelial function, the health of the inner lining of your blood vessels, which is crucial for preventing atherosclerosis. Magnesium also reduces inflammation, decreases blood clotting potential, and helps maintain healthy cholesterol levels, particularly by raising beneficial HDL cholesterol. A landmark study from the Atherosclerosis Risk in Communities project followed nearly 14,000 participants for 27 years and found that those with the highest magnesium intake had a 38% lower risk of sudden cardiac death compared to those with the lowest intake. For heart attack survivors, the statistics are even more striking. Proper magnesium levels can reduce the risk of a second heart attack by up to 24%. If you're in cardiac rehabilitation or managing coronary artery disease, magnesium supplementation, alongside your prescribed medications, could significantly improve your long-term prognosis. Dosages of 400 to 500 milligrams daily have shown the most benefit in research studies, but always coordinate with your cardiologist, especially if you're taking other heart medications. Sign number 4 that you need magnesium. You experience significant stress, anxiety, or have trouble sleeping. You might wonder what stress and sleep have to do with heart health, but the connection is profound and well documented. Chronic stress and poor sleep quality are independent risk factors for heart disease, increasing the risk of heart attack and stroke by up to 45%, according to research published in the European Heart Journal. Magnesium deficiency can create a vicious cycle. Stress depletes magnesium stores, and low magnesium levels make you more susceptible to stress and its cardiovascular consequences. This mineral acts as a natural stress reliever by regulating the body's stress response system and neurotransmitters that calm the brain. It blocks the N-methylaspartate NMDA receptor in the brain, which is involved in stress responses and anxiety. For sleep, magnesium helps activate the parasympathetic nervous system, the rest and digest system that allows your body to relax. It also regulates melatonin production, the hormone responsible for sleep-wake cycles. Poor sleep is directly linked to increased blood pressure, insulin resistance, and systemic inflammation, all major contributors to heart disease. A clinical trial published in the Journal of Research in Medical Sciences found that magnesium supplementation significantly improved sleep efficiency, sleep time, and reduced early morning awakening in elderly participants with insomnia. By addressing stress and sleep issues with magnesium, you're not just improving your quality of life, you're directly protecting your heart from the damaging effects of chronic stress hormones and sleep deprivation. The recommended form for stress and sleep benefits is magnesium glycinate, which combines magnesium with glycine, an amino acid with additional calming properties. Many patients report feeling more resilient to stress and sleeping more soundly within the first week of supplementation. Sign number 5, that you need magnesium: you have diabetes or insulin resistance. The connection between diabetes and heart disease is so strong that many cardiologists consider diabetes to be a cardiovascular disease. People with diabetes have 2 to 4 times the risk of developing heart disease compared to those without diabetes. What's less well known is the crucial role magnesium plays in glucose metabolism and insulin sensitivity. Magnesium is required for more than 600 enzymatic reactions in the body, including those involved in insulin signaling and glucose transport into cells. When magnesium levels are low, insulin doesn't work as effectively, leading to higher blood sugar level and increased insulin resistance. Over time, this contributes to type 2 diabetes and metabolic syndrome, both major risk factors for heart disease. The research on this connection is substantial. A meta-analysis published in Diabetes Care examined 13 studies involving over 536,000 participants and found that for every 100 milligrams increase in magnesium intake, the risk of developing type 2 diabetes decreased by approximately 15%. For those already diagnosed with diabetes, proper magnesium levels are even more critical for heart protection. Diabetic patients with adequate magnesium level have significantly lower rates of diabetic complications, including diabetic cardiomyopathy, a form of heart disease specific to diabetics that impairs the heart's ability to pump blood effectively. If you check your blood glucose regularly, you might notice improvements in your readings within a few weeks of starting magnesium supplementation. The combination of magnesium with vitamin D has shown particularly promising results, as these nutrients work synergistically to improve insulin sensitivity. For those with diabetes or pre-diabetes concerned about heart health, magnesium supplementation represents one of the most evidence-based approaches to addressing both conditions simultaneously. I want to address a common misconception about testing for magnesium deficiency. Many people have been told by their doctors that their magnesium levels are fine based on standard serum blood tests. However, this testing method is fundamentally flawed when it comes to assessing your body's true magnesium status. Less than 1% of your body's total magnesium is found in your bloodstream. 99% is stored inside your cells, primarily in your bones and soft tissues. Your body tightly regulates blood magnesium levels because even small fluctuations can affect heart rhythm and nervous system function. It will pull magnesium from your bones and other tissues to maintain normal blood levels, even when your total body stores are severely depleted. This means you can have a normal serum magnesium test while being significantly deficient at the cellular level where it matters most for heart function. More accurate testing methods include RBC magnesium, which measures the magnesium in your red blood cells, and magnesium loading tests, which assess how much magnesium your body retains when given a dose, indicating how deficient you might be. Unfortunately, these more revealing tests are rarely ordered by conventional physicians. This explains why so many people with normal lab values experience dramatic improvements in heart symptoms when they optimize their magnesium intake. They were deficient all along despite what standard testing indicated. If you're concerned about your heart health, don't let a normal serum magnesium test dissuade you from addressing potential deficiency, especially if you have any of the 5 signs we've discussed. Now let's talk about what makes an effective magnesium supplement, because not all forms are created equal, particularly when it comes to heart health. The bioavailability, how well your body can absorb and utilize the magnesium, varies dramatically between different types. Magnesium oxide, the most common and least expensive form found in most drugstores, has an absorption rate of only 4 to 5%. This means for a 500 mg supplement, you might only absorb about 25 mg. Additionally, magnesium oxide is more likely to cause digestive side effects like diarrhea. For cardiovascular benefits, the research strongly supports chelated forms of magnesium that bind the mineral to amino acids or organic compounds. Magnesium taurate, which combines magnesium with taurine, has shown specific benefits for heart rhythm and contractility. Studies indicate it may be particularly effective for atrial fibrillation and heart failure. Magnesium glycinate pairs magnesium with glycine and offers excellent absorption with minimal digestive disturbance, making it suitable for long-term daily use. For those focused on blood pressure control, magnesium threonate has shown superior ability to cross cell membranes, including the blood-brain barrier, potentially offering enhanced benefits for neurological aspects of heart health and stress reduction. The effective dosage range for most adults is between 300 to 600 milligrams of elemental magnesium daily, divided into 2 doses to maximize absorption and minimize digestive effects. Be aware that supplement labels can be misleading. They often list the weight of the entire compound rather than the elemental magnesium content. For example, a 500 mg magnesium glycinate capsule might contain only 50 to 100 mg of actual magnesium, with the rest being the glycine molecule. Look for supplements that clearly state the elemental magnesium content, and start with a lower dose, gradually increasing to allow your body to adjust. I'd like to share a case from my practice that demonstrates the life-changing potential of addressing magnesium deficiency for heart health. Maria, a 58-year-old woman with a 10-year history of paroxysmal atrial fibrillation, came to me after exhausting conventional treatment options. Despite trying 3 different antiarrhythmic medications and undergoing 2 catheter ablation procedures, she was still experiencing weekly episodes of atrial fibrillation that left her exhausted and anxious. Her quality of life had deteriorated significantly. She'd given up her beloved hiking, avoided travel due to fear of having episodes away from home, and lived in constant dread of the next episode. Maria's standard blood work, including serum magnesium, appeared completely normal. However, when we tested her RBC magnesium levels, they were at the very bottom of the reference range. We started her on a protocol of magnesium taurate, 125 mg of elemental magnesium twice daily, gradually increasing to 200 mg twice daily over 1 month. We also addressed dietary factors, increasing her intake of magnesium-rich foods like spinach, pumpkin seeds, and dark chocolate, while reducing factors that deplete magnesium, particularly her high caffeine consumption. The results were remarkable. Within 6 weeks, her episode frequency had decreased by 70%. After 3 months of optimizing her magnesium status, she went from weekly episodes to experiencing atrial fibrillation less than once per month, and the episodes were shorter and less intense when they did occur. Most importantly, Maria regained her confidence and returned to the activities she loved. Her story isn't unusual. I've seen similar transformations in patients with various cardiovascular conditions when magnesium deficiency is properly addressed. I want to take a moment to acknowledge something important. If you've been dealing with heart problems without anyone mentioning magnesium deficiency as a possible contributor, it's not your fault.
Our healthcare system excels at acute interventions, but often overlooks nutritional factors that can profoundly affect chronic conditions. The reality is that pharmaceutical treatments for heart conditions generate billions in revenue annually, while nutritional approaches like magnesium supplementation aren't patentable and don't drive profits. This creates a systemic bias against researching and recommending such approaches, despite their safety and efficacy. Additionally, modern agricultural practices have dramatically reduced the magnesium content in our food supply. Studies show that the magnesium in vegetables has declined by up to 35% since 1940, due to soil depletion and industrial farming methods that prioritize yield and appearance over nutritional value. Even if you're eating what seems like a perfect diet, you may not be getting adequate magnesium from food alone. These factors help explain why magnesium deficiency has become so widespread yet remains underdiagnosed and undertreated, particularly in cardiology. By educating yourself and taking control of your heart health through evidence-based nutritional strategies, like optimizing magnesium status, you're compensating for these gaps in our healthcare system and food supply. Before we conclude, let's discuss a few important precautions regarding magnesium supplementation. First, start with a low dose and gradually increase it to minimize digestive adjustment effects. Some people experience looser stools when beginning magnesium, which typically resolves as your body adapts. If this persists, try switching to a different form or dividing your daily dose into smaller amounts taken throughout the day. Second, timing matters. Magnesium is best absorbed when taken with food, and it's particularly effective when taken in the evening, as it can promote better sleep, which itself benefits heart health. Third, magnesium works synergistically with other nutrients, particularly potassium, vitamin D, and vitamin K2, all of which support cardiovascular function. A comprehensive approach to heart health should consider these interactions. Lastly, while magnesium is remarkably safe for most people, those with the contraindications we discussed earlier should exercise caution. It's always advisable to inform your healthcare provider about all supplements you're taking to ensure they don't interfere with your medications or treatments. Remember that while magnesium can be transformative for heart health, it's not a replacement for conventional medical care but rather a complementary approach that addresses a fundamental nutritional aspect of cardiovascular function. Heart disease remains the leading cause of death worldwide, and despite advances in medical technology and pharmaceuticals, the statistics haven't improved significantly in recent decades. This suggests we're missing something fundamental in our approach. The evidence for magnesium's role in cardiovascular health is compelling and growing stronger with each new study published. From regulating heart rhythm and blood pressure to protecting against coronary artery disease and improving outcomes after heart attacks, magnesium's effects are both wide-ranging and profound. Yet this information remains largely underutilized in clinical practice. If you recognize yourself in any of the 5 signs indicating you might benefit from magnesium supplementation, taking action today could potentially transform your cardiovascular health and quality of life. Remember to choose the right form, start at an appropriate dosage, and coordinate with your healthcare provider, particularly if you have any of the contraindications we discussed. The journey to optimal heart health isn't always straightforward, but addressing magnesium status represents one of the most evidence-based steps you can take toward a stronger, healthier heart. I understand how challenging and often frightening living with heart problems can be. The uncertainty, the limitations it places on your life, the worry about what the future holds, these are burdens you carry every day. That's why I'm so passionate about sharing this information and building a community of people committed to taking control of their heart health through evidence-based natural approaches. If this video has been helpful to you, please subscribe to our channel and give it a like so we can reach others who are struggling with similar issues. Don't forget to check the first link below to learn about a product that can help improve these health issues twice as fast as conventional approaches alone. Unlike many health channels, we're committed to providing information that's grounded in science, while acknowledging the limitations of our current healthcare system. We respect your intelligence and your time. That's why we focus on strategies that offer the greatest potential benefit with minimal risk and cost. Remember, improving your heart health is not just about extending your lifespan but enhancing your health span, the quality of the years you live. By addressing fundamental nutritional factors like magnesium status, you're taking a crucial step toward a heart that serves you reliably for many years to come. Thank you for your attention today. I truly believe this information has the potential to change lives, perhaps even save them. Your heart deserves the best care possible, and sometimes the most powerful interventions are also the simplest.